Nation, thank you so much for watching. This is a really exciting event. It's the Inato unofficial ACRP after party, and it reminds me of like a mini SOS conference. Were you able to
Yeah.
come out to SOS?
I have been to SOS a few
Thank you,
times.
thank you. It reminds me of like a mini SOS conference. We have Joel from American Institute of Research, and what is your role, and how long have you been there?
I have been with the American Institute of Research for 23 years.
23
I
years.
started as a clinical research coordinator and moved from research manager to director, now vice president of operations.
Wow.
Yes.
And the company has since expanded, I
Yes.
imagine, multiple sites.
Yes, we originated with internal medicine and nephrology. Now we have expanded from Laguna Hills all the way to Northern California.
Was that the first site, Laguna Hills?
No, our first site was in Whittier, California, and
Okay.
in Los Angeles.
Awesome.
Our corporate office is in Los Angeles.
Is that where you're based out of? Oh,
Yes.
perfect.
Yes.
Okay.
And we have offices all over California now.
Awesome. Yeah, I'm a SoCal native myself. I'm taking a short vacation in Yuma, Arizona
All
for the
right.
site, but I had a site here in Anaheim. I still have one in San Bernardino.
Yes.
So that's awesome to meet local SoCal people.
Yes.
So, how did you get started with them? You said early on as a
I came from labor and delivery at Long Beach Memorial. And I actually blew out my shoulder in all the rigorous activities, working in labor. And for lack of a better word, I researched what I could do, stay in medicine, and that would interest me. And I found clinical trials.
That's amazing. And you've been with the same company?
My boss and I have been working together for probably
Wow.
about 25 years, but he and I started at a different company.
Yeah.
We kind of had a little difference of opinion with the owners because I'm very pro patient,
Yeah.
and the previous owners for the company I used to work for was not.
Yeah.
And so I was actually recruited by Genentech to go work with them, and my boss decided to open up American Institute of Research, and I decided
Wow.
not to go to Genentech and to start this project with him 23 years ago.
This is awesome. So, I'm guessing biz dev, business development, getting studies for sites is a very important part of your job function. Very important component of any site, biz dev. This is why I'm a huge fan of Inato. And
Yes.
when they first reached out to me, it sounded like a scam. I was like, okay, what's the catch? Like, you guys are a broker, or you're gonna start negotiating my contract?
Exactly. Exactly.
Too good to be true.
Absolutely, and that was my same instinct last year when I attended ACRP, and I learned about Inato. It was the same thing because we have been approached for brokers and
Yeah, I
wanting
was approached today at
six
the
thousand dollars if we get the trial.
yeah, more than that.
Yeah.
It's
Now it probably is. We
yeah, it's more
refuse to
than
work
that.
with them.
Us too. Yeah. What tips do you have for sites that are thinking of jumping on? Because I have plenty of my own myself. Like as an actual user of the product, I'll admit initially it is a lot of work to set up your profiles,
Mhm.
and it does feel kind of mm, maybe disappointing. Like when you really want to study and you don't get it for whatever reason. Maybe your PI didn't have enough therapeutic area
Mhm.
experience, but I think they're working on that to make it easier in the future. But if you stick with it, like if you put in the work, it's actually a really good product to have.
And I think that's exactly the right attitude you need to have, is that I have, 23 years of experience. A lot of times, they'll look at my CV and say, okay, they don't have a lot of experience, but you do, so you
Hmm.
can hold their hands.
I've been in that
Um,
situation too. Yeah.
exactly. But it's an amazing. um, venue that they have. That
Yeah.
and the interview process. They really vet you, and I think that that's very
hmm
important.
The demographic section where you can, it rewards sites for doing the community outreach
Hmm.
efforts. Like we
Hmm.
have a Instagram, a YouTube channel, and
Hmm.
no one ever asks for that stuff, but I'm glad they do because we put all of our interviews on there and
Yes.
it shows us like actually doing the work and not just saying, "Oh yeah, we do community outreach." Well,
Yeah.
where's the proof? Like, take a picture,
Exactly.
do something.
Exactly. And next weekend we're doing a community outreach in Skid Row with one of our PIs who's urology, but he's going to completely assess the patients. So the research arm of us, we're going to help with blood pressures and everything for his project.
Yeah, no,
So you're
that's so
helping out.
cool.
We have a company who's providing lunch for the Skid Row patients, or people. They're not really patients,
Yeah, yeah,
but we're at least able to give them a little bit of health care.
yeah. And on the site profile, when they ask for your community outreach proof,
Yeah,
you have pictures
there it
there, like
is. Yeah,
from the Instagram or Facebook or whatever you guys
yeah,
have.
for sure.
What therapeutic areas do you guys do?
We're multi-therapeutic, so the only thing that we haven't dove into is psych. Um,
Okay,
but
there's a
we've
lot of that in SoCal.
for sure. So cardiothoracics, nephrology, urology, internal med, ophthalmology, neuro ophthalmology. We work with one physician in Newport Beach. She is one of 100 physicians in her specialty in the entire country.
Wow.
So I feel very privileged to be able to work with her.
Have you gotten a study for her yet?
Yes.
Through Renato?
Yeah. No,
Okay.
but hopefully we will
Yeah.
find something from Inato.
You know what I also like about Renato? It kind of gives you a pulse of the market because they do all the legwork of
Yeah.
talking to sponsors, and you kind of can tell what therapeutic areas are getting hot
Yes.
just by seeing what's new on their website.
Yes.
And then you can kind of say, okay, well, I noticed like a recent uptick in atopic derm, for example. So
Hmm.
that must be hot right now.
Yeah.
Or
Yeah. We've gotten pediatric asthma with Inato.
I saw that one. Yeah.
Yes, because we have a pediatric physician in Newport Beach who specializes in asthma.
Okay.
And rheumatology studies with them. Yeah.
Rheumatoid arthritis. I
Yes.
don't know if it was a NATO, but I saw a study recently. Maybe we had a network and share study leads
Yeah.
too. Um, that's pretty cool. So, who does the actual? Because I've been training my coordinators on how to apply for studies on Inato.
Hmm.
It's still me, like heavily, but I've been teaching Lana and Katie kind of how to do that.
Yeah.
How about you on your end?
We have a budgets and marketing director, and she actually goes through everything. But I've been dealing with Inadu personally because I met them last year
Yeah,
at ACRP, and then I introduced them to Annie, who's our budgets and contracts and marketing person. So she deals with them a lot now as well.
I like how you could collaborate with teammates on the
Yes.
same application.
Yes.
And then they save a lot of your information. So CVs,
Yeah.
profiles, you only need to do the work like once. They try to keep sites in mind, which is really helpful.
Yeah. Julia is amazing from Inadu. And she'll email me personally, say, hey, we have this study. Do you have a PI for it? And that's really nice as well.
Our site contact is Elaine.
Hmm.
So shout out to Elaine. She's not here, right? Ah, dang it. Yes, they seem to have pretty good site centric people there.
Yes.
And we'll get into more of the company culture when I interview Liz
Yeah.
next. So thank you
Yeah.
so much for your time. I really
Thank
appreciate it. You have a
you.
LinkedIn?
I do have a LinkedIn.
So we'll have her LinkedIn underneath. Everybody go connect, ask her more questions about Inato. You have like any last minute advice for sites thinking about Inato? Look, the biggest complaint, it's so hard to use, the studies are hard, and you need experience to have like to even have a chance.
That is one of the downfalls. Is I mean, I'm grateful that I have the 25 plus years experience in clinical trials, to be able to show our resume,
Yeah.
for what we've conducted. But they're amazing and they do work with you. So to try to help you get fitted into whatever therapeutic area that they have. And I just, for new sites, it's great because there's so many brokers out there, that you have to pay thousands
Yeah.
and thousands of dollars for. And
Forget it. You
if
don't
you
need
don't
it.
enroll, you're still paying the broker,
Yep.
for the money.
And
So,
I know it's anecdotal, but the last study I just been awarded by Inato just happened last week.
yeah.
It's actually one of the easier studies we have as a site. Only like a 25% expected screen fail rate. So
Oh, that's
it's
amazing.
not true that they're all difficult studies.
Yeah. I did question that, but I learned that it's not.
Yeah. Well, thank you so much. We really appreciate your time. And
Thank you.
everybody go connect, like, subscribe, comment, share. And thank you, Inato, very much for the opportunity.
We
Bye bye.
appreciate you.
Hey, if you guys like that kind of content, make sure you like, subscribe, comment, share. Stay tuned for more videos.